Lots of pain in the neck and the lower back. Any movement in my ankle, I feel it in my lower back. It's been a while. It kind of radiates from my knee to my hip, to my lower back, to my shoulder, and more so since I rolled my knee exercising.
Gotcha. And how long has this been going on?
It's been like since 2014. I rolled my knee, and I still kind of feel in the knee area where I feel like kind of a notching or kind of notching off. Like even when I try to move my hip, I feel that same kind of like the bone is rubbing against something in my hip or my lower back.
Okay, this is chronic, so it's barely registering at all. There's just 2 points to the right. Yep, that's a chronic nerve, right at that level. Okay, lean forward a little bit for me. There we go. So what I'm seeing right now is it's very subtle because it's chronic and it's old, but there is a small edema, a long band over here, a speed bump. You can palpate as well. It's protruding a bit. Tender right at that level? Got it. What about the one right below it?
Ow.
Even more?
Yes.
Right? Got it. I also see this small little band over here as well, another band. So there's everything trying to protect or guard this spot right over here. Oops, alright, so don't mean to poke. Don't mean to poke that bear. So let's take a closer look, see what's going on. How's that fellow over there?
Not too bad.
Not too bad. What about here?
A little bit more yet.
A little bit more, but not too bad. Got it. How's that? A little tender, correct?
Yes. Ooh.
I said it,
Ouch.
tender. But here's the thing, all these are moving,
Ouch.
even though they're tender. See over here, your hip is stuck. It's not going forward on this right side. And your left hip, that is moving just fine. The sacrum, even though you feel tender, it's moving all just fine. And this bone over here, that's very tender on you right now. See the difference right here?
Yes.
You can't turn to the right whatsoever.
No, I can't.
You can easily move to the left.
Yeah.
You have some interesting abnormalities going on.
Okay.
The very first thing, we have 7 bones in the neck, 12 bones in the mid-back. We're supposed to have 5 in the low back. You have a 6. 1 extra bone right over here.
What?
Yeah, you have 1 extra bone. That's pretty cool, isn't it?
Hysterical. Only me.
So when I take a look over here, this appearance, it's supposed to be like this. We're supposed to see these.
Okay.
Yours is trying to merge with your sacrum itself, meaning this triangle-shaped bone over here. See how it is a transfer process over here? You're trying to merge and become part of the sacrum itself. That's what we see over here.
Okay.
But there's still a residual disc over here. So it's not fully fused.
Okay.
So this is your 6th lumbar. So the other components that help explain why you experience this low back, there's still instability to the point that that's what throughout your right knee, the foot, the leg pain, so on and so forth. 2 aspects. Number 1, from what I see over here, see these 2 bones? They don't line up. See how much forward this 5th lumbar is? It went more forward than your 6th. That tells me this bone is fractured.
Okay.
So this is what we call a pars fracture.
Okay.
Right? So that's where the lucency is, right here. You have a small little break right there. And it's enough that slid a little bit forward. And that's where everything else right on top of it became unstable.
I see.
So if you notice, when we checked this last bone on you, yeah, it listed a lot of pain. But also when I checked on this one, also not fun either. And I just gently touched it.
Right.
Another thing, that's why I asked you on the history, if you had any falls or what have you. You have an old fractured bone over here. Okay, so this is 1st, 2nd, 3rd. So this is between your 3rd and the 4th. Right there, you fractured. It's supposed to be one continuous piece. What we see over here. 1 piece over here, 1 piece over here. So in essence, what it did was,
Like
it
that.
jammed that way.
Yep.
So that's why every single segment, when I tested it, it felt painful on you. It's not stable. None of it. Exactly. So,
Jeez.
can we fix that? No. That's a done deal. And you told me before, you fell really hard. What was it, on that seesaw, you said?
Yeah,
When
I fell off. Like I hit, there's concrete or whatever was underneath.
Ow.
And it landed on my butt. But that was forever ago.
Right, so 8 years ago, right? So that's a long time. So we're talking 30 plus years. So, yeah, that's a done deal. I can't fix that. And even surgery is I don't know how many surgeons are willing to say, maybe, maybe not.
No.
Okay. Because your body adapted that.
Correct.
However, when I take a look at everything else, and what I do see, what we do need to correct today, is that 6. Why? Because this fractured off. Now, we can't fix this one either. That's also a done deal.
Yeah.
Right? There's no way to put it back into its proper place.
Right.
What we can do indirectly cause more biomechanical stability is we could push the structures underneath it to provide more stability on top of this one. In addition to, we already confirmed it, there is instrumentation reading at this level. And also, when we challenge it, yes, it elicits a lot of pain for you. And also on top of that, we checked your whole entire pelvic foundation. It's moving just fine. This is the only one we need to correct on you.
Okay.
Right, let's roll. Right there. That's true, right on you. When it's only over, don't worry, you're not gonna fall. Just let it go. No. Okay, walk on. Feel me, huh?
Yeah,
You notice that's different.
I don't feel so much of the popping in my hip when I walk. Usually when I take a step or I feel like I put my weight on my right leg, because I feel like I don't usually, I feel like my thigh bone is jamming up into my hip and I feel that pain, but I'm not feeling that so intensely anymore. It's less intense, so I can put a little bit more weight on it, so I feel more upright. And this is less. Usually when I wiggle I feel it pull all the way in my lower back, and it's not as intense as it was before. So that's an improvement. That's an improvement. Thank you.
Oh, you're very welcome.
Yep. Great.
Okay.
Perfect.
Well said.
Yeah, thanks.
You're welcome.
Take care.